Thank you all for joining the National Institute on Aging today in our inaugural Spotlight on Healthy Aging virtual series. I'm Michael Nyssen, Executive Director of the NIA. The NIA is a Ryerson University think tank based at the Ted Rogers School of Management. We're focused on the realities of Canada's aging population. We're Canada's only think tank dedicated exclusively to public policy solutions for an aging population. And we work at the intersections of healthcare, financial security, and social well-being. With the backing of Ryerson University and our partners, we work across the private and public sectors to explore the challenges and opportunities of an aging population. I'd like to start the session today by thanking our sponsors for this event, RBC Wealth Management Royal Trust in Essity, and a special thank you to ECW Press for providing 3 lucky attendees with a free copy of Moira Welsh's new book, Happily Ever Older, Revolutionary Approaches to Long-Term Care. We'll be conducting a random draw after today's event for 3 attendees to get a free copy of the book. If you haven't read it, it's a must read. I spent a good amount of time with it a couple of weeks ago and don't regret it. It's absolutely a pivotal piece of literature, I think, on an issue that's dominated the Canadian conversation nationally for the past year. The winners will be contacted directly and announced on Twitter following the event. Leading the session today is Dr. Samir Sinha. Dr. Samir Sinha is the NIA's co-founder and director of health policy research. He's a passionate and respected advocate for the needs of older adults. He currently serves as director of geriatrics at Sinha Health System and the University Health Network in Toronto. He's a Rhodes Scholar, a highly regarded clinician and international expert in the care of older adults. He is also the architect of the Government of Ontario's Seniors Strategy. Maclean's magazine proclaimed him in 2014 as one of Canada's 50 most influential and most compelling voices for the elderly in Canada. Dr. Sinha was recently appointed to serve as a member of the Government of Canada's National Seniors Council and has been tasked to lead the development of a new national long-term care standards for Canada. So of course, today's event is called Even 4 Hours a Day Won't Cut It, Why Transforming Long-Term Care Needs to Start with Empathy. As anyone who's been paying attention this year knows, societal ageism has led to inadequate systems of care for older Canadians, particularly in long-term care. The COVID-19 pandemic has brought these gaps and systemic failures to the forefront of national attention. Moira Welsh, a distinguished Toronto Star investigative reporter, has spent years investigating retirement and long-term care homes, working both to expose the deficiencies in our systems of long-term care, as well as profiling the resilience of older Canadians. These stories are not an account of falls or bed sores or over-medication, but of older adults living with purpose, energy, and love. These are powerful stories with the capacity to change perspectives on the status quo. And so in this first webinar in the NIA's new Spotlight on Healthy Aging series, Dr. Sinha will dive deep into conversation with Moira Welsh on her new book. The book is warm, inspiring blueprint for change, proof that instead of warehousing older adults in Canada, we can create a future with strong social connections and a reason to go on living for those who can no longer do so in their own homes. Moira Welsh and Dr. Sinha will discuss examples of excellence in long-term care from around the world. This includes models that have yielded positive results, strategies for addressing loneliness among older Canadians, the importance of inclusion, and the concept of potential, the idea that we can constantly thrive and improve no matter what our age or ability, and the right environment can help us do so. And with that, I'll turn it over to Dr. Sinha.
Thank you so much, Michael, and it's great to be here, and thank you for all the attendees who've joined us today to be a part of today's important discussion as well. I just want to get to introduce Moira. I've been working with Moira as a person who gets calls and emails from her asking to respond to her questions, to her investigations into long-term care, and we've come to know each other, over the years, and have, you see what you see in printed in the newspaper, but behind that are often these very thoughtful conversations where I've come to realize that Moira is unique among many in terms of taking her work quite seriously, not interested in just getting a story out, but really getting underneath the issue and really trying to advocate for change. And that's why the book that she recently put together really is kind of an example of what she has done to really try and change the conversation and make sure that we understand what needs to be done to move forward. So just a bit more about Moira. She's an investigative reporter with the Toronto Star. She's written exclusively on seniors issues with a focus on long-term care, along with issues related to social justice, health, and the environment. Moira has also co-authored investigations that have won 3 national newspaper awards and a Michener Award for public service journalism. She was a finalist for the Justica Award for legal reporting and the Canadian Hillman Prize for journalism in service of the common good. And as I mentioned, she is the lead author, or the only author really, for Happily Ever Older, which is about evolving ways to live in our later years. And so with that in mind, I just want to say, first of all, welcome, Moira. Thank you for being here today.
Thank you so much, Dr. Sinha. It's a real honor to be here, and I appreciate you having me come and speak to you.
Okay, and the first rule is, if you're going to call me Dr. Sinha, then I'm going to call you Welsh. So how about we just do the Samir and Moira thing?
Sounds good.
Awesome. Okay, so here I'm gonna pepper you with questions because, again, I really appreciated receiving your book early on and being able to read through it as well. And I just wanted to ask you some questions around it because it really is a tour de force of optimism and opportunity. I think a lot of the work that you've done over the last number of years is really talking about the failures that have occurred in our long-term care systems, issues of bed sores and elder abuse and that. But really, you took a real different approach, and I think also one that you were featured on more recently when you started featuring some real positive changes occurring a few years ago in our long-term care system in Ontario. So really, it's a tour de force of optimism and opportunity for how to apply an empathic human approach to long-term care in Canada. But before we turn to the future, I'd like to ask you a few thoughts about how you felt that COVID-19 tore through long-term care during the pandemic. And as you look back at the past year, what are your main takeaways?
That's such an interesting question. I would say my main takeaway is that ageism led to trauma, and systemic ageism I'm speaking about within the system. It was at the core of the devastation that seniors and their families and staff experienced. And as I wrote in the prologue of my book, we watched while COVID killed seniors across Europe and then came to major American cities and had the same impact. And we knew that it was coming here to Canada. And in Ontario, for example, some homes did prepare. Many did not. And we know that the government focused quite rightly on hospitals at the beginning, but it also could have acted on warnings from many in the industry. And I recall you, Samir, tweeted very early that seniors' homes would blow up like a tinderbox if this was allowed to continue. So at the beginning, when long-term care and retirement home residents were dying, a lot of people said, well, they're old, so it doesn't matter. They're going to die anyway. And it's as if at a certain age, we as a society, but also the system that cares for older people, didn't really consider them human or worthy of survival. But from a broader perspective, I think what we saw through the pandemic is that governments and many homes also place little value on the lives of older adults, as if they're not capable of emotion or deserving of engagement and happiness, let alone protection from a deadly virus. What's really interesting to me seeing this now, and I think to many people, is that there's a shift beginning. And I think it's brought on by a confluence of events, the unnecessary deaths of thousands living in crowded congregate settings, and the fact that the most powerful generation in modern history started turning 75 during the year of the pandemic. People want to protect their future selves. So if I was a politician, I would be very aware of that fact.
That's really interesting because I think when you think about it, we now know that there are more older people than younger people in Canada. And that was something that started to occur a few years ago as the baby boomers started to age. And soon by 2030, we estimate that 1 in 4 Canadians will be older than 65. So that's less than a decade away. But you talked about how ageism really, in your view, was kind of the key underpinning for potentially quite a deadly response or a deadly outcome for too many. And I guess, it was interesting. I always saw this commentary that someone wrote early on to say, if these were children living in schools, for example, these were what we call boarding schools, for example, would we have acted differently if we saw this level of death, or if this was a disease that was that had a high rate of death amongst children? Would we have reacted differently? And I think it really gets to that point about ageism. I don't know if you had that thought too, that, you know, if these were children, would we have reacted differently, you know, the way we have towards our older people?
Absolutely, we would have reacted differently, and I think it just shows the value that we place on the beginning of life and the end of life. And what's so interesting is that, you know, our parents, for example, might be 90 years old, but they still might have another good decade of life in them where they're very vibrant people. And so we don't really have the right to take away the ability for them to survive a pandemic just because they're older. They also, even if they have a year or two left, they mean something very deeply to their families and their loved ones. So I think it's sort of, we're very much aware now that we need to really push for greater recognition for the rights of older people.
Well said. So you've been writing about long-term care for the Toronto Star for years, and you've covered more than your share of tragedies, policy failures, and the lack of political will of all parties to fundamentally center care around residents. So can I ask you, you know, what made you interested in long-term care initially? I mean, same question people asked me. You know, why are you interested in working with older people? What got you interested in long-term care in particular?
It's really interesting because when you're an investigative reporter, you have to be a little bit entrepreneurial and come up with your own ideas. And so back in, I think it was the end of 2002, I had been reading stories about the demographics, the shifts in demographics. But at that point, the first wave of the boomer generation was still quite young. But I thought, you know, I wonder how we as a society and our governments are preparing for the eventuality that people will become more vulnerable. So I suggested to my editor, Kevin Donovan, why don't we look at long-term care homes? So we spent almost a year doing freedom of information requests and a lot of reporting based on the outcomes of those requests. I got thousands of documents of complaints related to long-term care homes. Through sources, I was able to get, oh my gosh, thousands of inspection reports and also serious occurrence reports from the government. And through looking at those, we did a pretty significant investigation that ran over about a week and a half at the end of December of 2003. It just so happened that there was a new government at that time and a newly appointed health minister named George Smitherman, who quite nicely invited me into his office to give me an interview about my investigation. And he ultimately promised a revolution in long-term care. And so initially, I decided to follow that revolution through, and didn't quite happen, but that was the beginning for me.
Yeah, and I mean, I think I think that was an interview that you held with him where he ended up in tears and really promised that. And I think I think it really spoke highly of the quality of your reporting and really kind of helping to frame the issue and at least, you know, a call for action in that way. So many of us who work in this space professionally as doctors or policy experts or advocates are constantly fighting to keep attention on the needs of Canadians in our long-term care settings, but also older Canadians in general. So why pick such a thorny subject that so few people have wanted to talk about, or much less to do anything about? Or even as you said, you know, you had the Minister of Health promising a revolution. You identified that, you know, a lot of that revolution didn't quite materialize. So why stick with this issue?
It's a social justice issue. And it's also a multi-generational issue. There are so many very vulnerable people in long-term care. Some people probably do not need to be in long-term care, but a great many of them are very, very vulnerable. And to be honest, none of us really knows if that may happen to us in the future. It can take a significant health, serious health impact on our lives, and we need help. So I think for me, it became a social justice issue. And my newspaper, The Star, places a significant emphasis on that. So I really decided to look at it from that context. And I kept doing stories that didn't really result in significant change. And there were some changes to policy and perhaps some changes in legislation. But for me, it was simply the fact that there so many people are impacted when the care is wrong. And that bad, so to speak, to simplify it, care can impact families for the rest of their lives. The guilt that people feel when they can't care for their loved one at home, first of all, but secondly, they place them in a home, often against, after promising they never would, place them in a home that does not treat them well, allows some very negative experiences to happen. Those families are left with this like quite devastating guilt that will stay with them for a long time. So for me, it's an impact, it's an issue that impacts many, many people.
Yeah, and I remember even just during the pandemic, I think one of the stories you asked me to work on with you was really about the experiences that families and residents were having just from the severe isolation and loneliness that was happening to them through these lockdowns, being isolated in their rooms. And I remember you asked me, do you have any patients and families who are going through this? And I think I relayed you a few stories that weave their way into your story, just really putting a face on what I was hearing as a clinician from some of my own patients who were residents and cooped up in their rooms and really feeling like they were literally like caged animals. And really, I don't think it's a perspective that we think. We just think these are people living in these homes. But as you said, right, it's how do we think about the residents themselves as human beings with wants and needs, just like the rest of us, and their families being ones who want to be able to see and engage with their loved ones. And so, I mean, it's just an example of how it's important to keep telling these stories because it's so important.
And I recall one story that you told me of a woman living in a retirement home who felt that she was committing civil disobedience because she actually left her room and sort of looked around, from left to right, and went for walks because she was told she had to stay inside her room. And she didn't want to lose her ability to walk because, as you and I have discussed with older people, you can become very fragile very quickly. So she wanted to maintain that. But that image of that woman stayed with me for a long time. I thought that was a great story to tell.
Absolutely. And I remember her asking me permission if I would support her acts of civil disobedience. And I said, absolutely. And again, really speaking about, again, this is, as you said, it's a social justice issue. Like we have to treat these people as human beings. So Moira, on top of covering the subject in depth, you're also bucking the trend a bit because again, I think you could have just written a book that really just talked about, the horrors and the tragedies, but you really took, the title, Happily Ever Older, you're focusing on the positives. And what made you want to take, a positive approach in your book? And if you wrote the book after what we witnessed during the pandemic, would you still have been as positive?
So in the context of my book, positivity is meant to disrupt. It's meant to subvert or upend old institutions. So I specifically approached it with that in mind. And for me, the positive examples show and they prove to governments and long-term care operators that innovation works because it has long succeeded in multiple homes across North America and into the Netherlands where I visited two homes. And while it still takes focus to uphold those changes, there are many, many teams of leaders who've maintained these approaches for years. So that means that here in Canada, there are no excuses to let the old institutional system prevail. So yes, I've written untold negative stories on long-term care, but and there's still a place for these stories, I think, many different times if they're warranted. But I started to see over the years that all of the work that I did, it didn't really lead to anything, and it didn't actually help people believe that it was possible to improve the system. And so it was sort of an interesting interaction between my own evolution in covering this issue as a journalist and a meeting with a US geriatrician named Dr. Bill Thomas. And this was several years ago. I was researching a story on changes in one dementia household in Peel region. And I interviewed Dr. Thomas for that, the documentary that we did for that story. And it was so interesting what he said to me. He said, you could write a negative story every day of the week and nothing would change because it would only lower the expectations, giving a pass to the ministry and the operators who said they were doing their best. So to me, an investigative reporter who's trained to uncover the worst, this seemed like a very radical concept. But again, I'd reached the point where it made sense to prove the case for change in a different way. And so my goal with Happily Ever Older was to actually document in detail the models or philosophies that have been used in these homes for many years. So there's no excuse and no reason why we cannot do the same in Ontario or across Canada. And I
Go
think you
ahead.
asked if I wrote the book now, would I have done it differently?
Yeah.
Um, I think if I started writing the book in the pandemic, I actually wouldn't have had a book because I wouldn't have been able to travel. But if I had more time to publish my book, I believe that I would have, it would have been even stronger with a focus on emotions, because we saw, as you just raised the issue, we saw that people who were isolated and lost their emotional connections to their families and to workers declined physically and mentally throughout the pandemic. And it is a mental health issue, and we need to take that very seriously. It's as if, in a sense, we've been looking at older adults who live in long-term care homes or in retirement homes as if they just need a place to stay and nothing else. And their lives are as rich as our lives. Their wants and needs and interests are just the same as ours. And so what we all watched during the time of COVID was people wither, not from the infections necessarily, but from loneliness. And even there was a recent UK study that concluded that many died for this reason. So early in the pandemic, I think because of my book research, I was able to produce some Toronto Star stories that looked at the terrible impact of loneliness and trauma on seniors, and interviewed you for those. And I also have to say, and I'm thinking about this now, is that so many workers also experienced trauma. Families did, residents did, but the workers also did. And watching people decline, unable to allow their families to come in and say goodbye as they died alone. And quite recently, I interviewed some nurses who broke down and cried while I was speaking to them on the phone. And they were talking about the isolation that everyone felt during the pandemic. And I remember talking to one nurse. She worked at a home in southwestern Ontario. Just the tenor of her voice, the way it trembled as she spoke, I still think about that now. It's almost haunting, the emotional piece that she's carrying with her because of this.
No, beautifully said. And I know that's one of the things I wanted to pick up, and nice segue, because one of the things that you've been doing more recently is really focusing, when you did your major investigative series, around kind of this idea of emotion focused care, and really profiling the journey of one home in particular in Peel region that implemented a model called the butterfly model. I think what was really compelling in that work was you were not only talking about how it transformed the lives of residents and their families, for example, but most importantly, it was focused on transforming the lives of the staff. It was giving them permission to care, and giving them permission to bring themselves to work, and support the residents in the way that they felt was truly meaningful and impactful. And it was fascinating to see from your research and from the work that was being done that staff absenteeism, sick days, those sorts of things were being significantly impacted because people wanted to come to work. People felt that their work was really meaningful. And I think it's interesting that you've just noted here about how the positives, the positivity of taking these different approaches is really recognizing how not only would this be good for residents and their families, but it also be great for staff as well. And can you talk a little bit more about some of the insights you found by just really, by thinking about that lens of those who are working in long-term care?
Absolutely. It makes a very significant difference in the lives of people who work there because it gives them purpose. So we're talking in a sense about these ideas and philosophies giving the residents of the homes purpose, but it also gives the staff the same feeling. So they have the autonomy in these very progressive homes to make decisions about the emotional care, not the medical care, the emotional care of people within their who they're connected with. And they're also Usually some of the better homes offer very small household designs. So you have, dedicated workers to a small group of people. They really are able to create very rich relationships with those residents and with their families. And so that's very important to people. But in a sense, it gives them a different perspective on work. They're not rushing from task to task. They're not expected to get people up and out of bed within 6 or 7 minutes every morning and rush them to the dining room and line them up. So it's a completely different approach to care. And so I think what that does is when you see homes like that, it's a bit of the law of attractions, so to speak. It brings more people who are interested in a different kind of caregiving to the industry. And so right now, I mean, we've always had, the industry has long had shortages with staffing, and certainly after the pandemic, that's very true. But if people see that they're able to be treated very well in the homes, because all of the leaders that I spoke with said, if your workers are happy, your residents are happy, but they also have the ability to truly make a difference in the lives of the people in their care, you're going to attract a different type of caregiver. And there's one example. There's a gentleman, I just heard about this the other day, who was worked for decades in an iconic downtown Toronto hair salon. And as a hairstylist, he would be very astute at connecting with people. And so he was just a real people person, very emotionally intelligent. He actually ended up leaving that career and trained to be an RPN. And so he's now working in a long-term care home. And he's got people up dancing and laughing. And that emotional intelligence that he brings to the job, that's a special thing, first of all, for this industry. But second of all, it allows him to read people's needs. So in times when they need solace, he can offer that to him. And he can also bring zest for life, which is also so important to all of us.
Incredible. So before we go to just answering some of our audience questions and answers, so we'll just remind people who are attending that if you do have a question that you'd like me to pose to Moira, then happy to do that. Just put that into the question and answer box so that we can get to it as well. But Moira, my last question is, right, so the title of our session today is, 4 hours doesn't even cut it. And I think that's referring to the fact that currently in Ontario, homes, whether they be publicly funded or all homes that are publicly funded are being publicly funded to provide 2 hours and 45 minutes a day of care. That's what they're funded to provide. But last year, at the start of the pandemic, the government's own staffing study basically said that we should be providing at least 4 hours a day. And so this government has committed to doing that, but they're not going to get that done, they say, until 2024, 2025, because they have to hire literally tens of thousands of additional workers. So some would just argue, that, really, the reason why care is not as good as it could be is we just need more workers, right? So, if we just have more workers and we're providing people 4 hours of care versus 2 hours and 45 minutes of care a day, that's all we need. But the thesis of your work it's not just about hours of care or just more boots on the ground, but it's actually how those staff interact or supported to interact with their residents. Am I getting that right, or am I missing something?
No, that's absolutely correct. And, I've said to people, let's not be so grateful for 4 hours of care. That was a promise that was made many years ago. And while it would make a significant difference, and nobody needs to complain about the fact that we would get 4 hours of care, although we might like to have it sooner in homes, it's a very, very important piece that advances some of these issues, as would more air conditioning and a lot of other sort of structural changes within homes. But significantly, that is not going to change an institutional culture. You will have another worker or so on shift, but they will still be following the tasks, still be working within a long-standing old style structure. And so what these ideas and philosophies and these leaders that I've met with are saying, no, we can do this completely differently. Let's turn this around. You have more staff. That makes it easier to make these changes, actually. So that's a great benefit. But unless we start really looking at older people and their families as valued members of the long-term care homes and not just someone who's sort of, they're part of, in a sense, in a factory-like setting, we're not going to really change anything within the system. And that's why these new ideas would create lasting change and treating people with value, giving them the freedom to make choices for themselves during the day, pursue their individual interests instead of sitting in a chair and staring at the floor. I can't tell you, and I'm sure you've seen it as well, how many times anyone who visits a long-term care home, even a good long-term care home, will see people sitting in the TV room staring at the floor. And so that changes in these very sort of progressive homes, and people are allowed to pursue their interests. They live up to a new potential at a different stage of life. A lot of people have learned how to paint. One woman I met in Saskatoon at the age of 91 bought her first bathing suit and learned how to swim. So this gives life to people. So they're always moving forward. It doesn't matter how old you are, you can always move forward and adapt based on whatever you're able to do at the time. And so I think that's the difference. The 4 hours is great, but it's not going to change this very entrenched institutional system.
Well said, well said. So we're going to look at just getting into the questions now. And wow, we've got a lot that have come in already. So I'm going to, so we have our first one is from Trish, and she asks, given that long-term care, institutionalized living is really the only option most people have to provide care to older adults who need more care than what they can provide, how can we in Canada move forward to create alternative living accommodations and a normalized life until the end within the community, or how do we make that a reality? And at the same time, change society ageism views?
Oh, an excellent and very big question. Thank you, Trish. First of all, we need a different approach to care. And I know you, Samir, have discussed this as well, a greater emphasis on the community end of the continuum of care. And so that would help us with more home care for people who perhaps are perfectly fine living on their own. Like, for example, my parents were, but perhaps needed some help to come in, not to give them showers, but maybe to help cook some food, to take them grocery shopping, to shovel the driveway, and so on. So that gives people a lot of support, just maintaining their independence. And that's a really, really big piece. But also for people who are younger, but looking for new ways to live, there are lots of different options. And it's not necessarily something that the government is pushing, but something that people are doing on their own. For example, the Golden Girls housing, where people who are over 65 have decided, a number of women have decided to get together and buy a portion of a home together. And I do think that the government did actually step in, the province, to make some changes related to that, to help more homes set up that way if they need to. But those are different approaches. People are individually choosing, for example, to buy new build condos on the same floor, so their friends can all live together, and if they need to, they can share a support worker later on if it ever comes to that. But it's built in community, which is really helpful. And I recall in about a decade ago, Samir, you did the report on the senior strategy for Ontario and discussed NORCs, the naturally occurring retirement communities. And people are really starting to talk about those now. And I wrote about them in my book as well, because they actually, some of these are naturally occurring. So it just might be an apartment building where people are naturally aging in place, but you can also try to create some emphasis around that and bring in supports for people, again, if they need it. But the sort of the goal is to create community so that people are engaged through life, and especially people with cognitive decline, so that they're not isolated through the years, but they're sort of wrapped up in all sorts of different programs and different groups as they age moving forward. And one other piece of that I think is really important, especially for people with memory loss, are really enriched day programs. And I saw this down in San Diego, and in Toronto, we've had some as well. And they make a significant difference in keeping people out of and delaying the entry to long-term care, and also giving family members time to, go to work, do some shopping, or just take care of themselves in addition to caring for their loved one. So there are lots of options out there, but we need a greater emphasis on that. Absolutely.
Wow. The Louisa asked, for example, I'd appreciate knowing more about what you discovered when you were investigating some international models. So what did you find from when you traveled to the Netherlands, or when you've investigated some programs in the US? Like, what did you see there or in other places that you haven't seen in Canada? And if you could bring any of those back, what moved you and said, why can't we do this here?
In the Netherlands, there were I visited De Hogevik, which is the village concept. It's an enclosed village, and it's so interesting to me because many of the leaders that I met said whatever they built 15 years ago, they would have done it differently now. They would have made it more inclusive. And so there's 2 points to that. One is that these are people who are not afraid or don't get defensive and say, I was right. They don't just stay with what they've got. They're always moving forward and readily admitting that time changes and ideas change. And also this new move towards inclusion. And so I think that's a really big piece of it. De Hogevik was very interesting because people live in very small households of about 6 or 7 people, with bedrooms split almost in half on either side of the home. And they have the freedom to step outdoors and go walk and sit in the cafe, go to a restaurant. And so the built-in freedom there is a big piece of that. And I think we're really missing that in many, many homes here in Ontario and in Canada. I know a lot of people don't feel the fresh sunlight on their skin after they move into a long-term care home. They don't go outside anymore, especially people with cognitive decline. Many of them are in locked units. And so that's really changing. I'll give you another example. In North Carolina, there's a community called the Carroll Woods Retirement Community. It's a very special place. It's built on 120 acres of oak trees, and it's absolutely stunning. And I'm not saying that we can duplicate that in such a way here, although we could in certain locations. But their philosophy is that the people who do not have cognitive decline are trained to help the people who do. So it's a very inclusive community. Nobody is left out. There are about 80 different community groups, all run by the people who live in the home. So there's no structured activities for the day. It's the residents who decide, and they all look after each other. So if I have some memory loss and I get lost walking back to my room after dinner, somebody will help me along, and they might pass me to somebody else who will help me to my home. But there's a real support for each other. And I think those are some really interesting concepts that people are starting to talk about more and more, is freedom and inclusion.
Excellent. Another question that's come in here is saying that some countries do not have the word retirement in their vocabulary. So as we live longer, are we expected to, they said, are we expected to be off for 30 years or more and play golf, for example? So how would we respond to that? Or like, how do we should we be thinking about this kind of this period of our life? Because I think sometimes we like to call it, way back when, we timed, Social Security and these sorts of things to start when you turn 65. And I always used to joke it was a great trick, 100 years ago for politicians, because, everyone was like, this is great. When I retire at 65, I get a pension, I get this. But the key is that most people didn't live beyond 65. So it was one of those, that notion that was really there. But now, if you make it 65, and most of us will, people don't appreciate they'll have about 20 years of life expectancy ahead of them. And the majority of those years are going to be relatively good health. So it's interesting. I don't know where these are places where they don't have the term retirement in the vocabulary, but how is some of the work that you've been doing thinking about how should we characterize that third age, as some people would call it, or how do we need to approach that?
It's so interesting, and I'm starting to look into that now, actually. And it's a really interesting piece. People call it, as you say, the third age or the third act. And what it does is it gives us a lot of time to stay involved in the community, whether it's through work or volunteering or just being very, very active in whatever way we choose, going back to school and getting a degree or a different degree. But I think there's a real goal among a lot of people who have lived very well, they're very healthy, and they're seeing that 30 years stretch ahead of them and saying, I cannot sit at home and golf or play pickleball for the next 30 years. So they need purpose. And I think that's the point. And I know from people who do retire that it's nice for the first few years, but at a certain point you really do need to do something else with your life. And so I think we collectively need to talk about that and also talk about work for older adults who still have much to offer.
Now, it's interesting. I was having one of my first pandemic dinners outside with another couple on the weekend, and we were talking about our futures and what does retirement look for us. And my one friend was saying, well, he's another physician, and he said, I plan to, I want to go back to school. I really want to go back to school. And our partners were like, yeah, no, not for us, not for us. And I'm like, I want to go back to school as well. And we said, great, well, we'll go to school together and we'll come here for lunch every day and you guys can do your own thing and so on. But it was interesting that I think a lot of people don't think about how they're going to think about their futures and how to plan. And why do you think that is? Why do you think that we're not concentrating on realizing that we've got 20 to 30 years ahead of us, and therefore we need to think about what is it that we're going to do with that time, but what is the type of care we might want to receive? Do you think that that's changing over time through the work that you've done, or do you still think that people just don't want to think that far ahead?
It's a great question. People don't plan, first of all, for the future. And I think we're starting to talk about that now. And especially the pandemic has made so many people start to recognize the fact that there are a lot of seniors, they have not been treated well and they can be vulnerable. But when you're healthy, there's a great opportunity to plan for the future. And a big piece of this is to stay healthy. And that's really up to us in many ways to stay active. And Samir, you and I have discussed this many times about physical fitness, getting your hearing checked. There's so many different ways that we can stay very sharp and very strong as we move older. And that helps us with aging well into our 90s if we can. And so I think people are just starting to talk about this. And what's really interesting is that a couple of years ago, when I interviewed Dr. Thomas in the States, he said that the first wave of the boomer generation has never thought about aging. They were the people who weren't going to grow old, so to speak. And he said, when that does change, that's going to be like a train coming down the tracks full bore. And so I think that is starting to change now. And so these discussions are becoming more commonplace, but certainly it's sort of at the beginning of the conversation.
So we've talked a lot about this idea of like emotion focused care and the need to really infuse kind of that opportunity for staff to just, as you said, develop or have time to develop that skill of a strong level of emotional intelligence and empathy and just have the time to provide that great care. And one of our attendees, I hope I'm saying their name right, Meimu, has said, so what should the homes actually look like then? Should we be, you talked a little bit about Dahogovic and what you saw there, and you've obviously been touring around. I don't know what the homes look like in Carroll Woods, but they ask, shouldn't we be creating smaller care homes, basically houses in a community? Wouldn't this be better for rich relationships and easier to handle pandemics? And I think you're probably familiar with one of the models. I think that Dr. Thomas, as we mentioned, has been involved in this idea of the greenhouse model and these small home-like ones. But do you think there's a place for institutional, bigger kind of things, or do you really feel like, no, if you could actually be in charge of saying this is what a home should look like, what would that look like to you from the work that you've done?
I would not build any more homes that have 32 bed units, so to speak, with a big nursing station and bright lights. And I would not do that. And because maybe it's difficult right now to tear down existing homes, I would revamp those homes and renovate those homes into smaller households, which is quite possible to do. And the greenhouse is an excellent example of that. And in fact, as you noted, they very small households, they did very well with COVID infections. There was a study from JAMDA that spoke about very low levels of COVID and very low number of deaths during the first wave. And you can create a greenhouse home within a bigger structure, but you have to make it a smaller household. And so we are slowly seeing that happen now. I know some of the new builds are in Ontario, for example, are creating campuses of care, and they're able to build small households for about 8 people. With cognitive decline, and then slightly bigger households for about 16 people who do not have cognitive decline within those structures. But I think we need a lot of choices. So greenhouse, I visited one in a community just outside of Rochester in the United States, and it was in a residential community. So there were 2 homes of 10 people with private bedrooms, a beautiful hearth, which is at the center of the home, a gorgeous open concept kitchen, and a long wooden table where everyone ate dinner together. And there's just a real community feel in that. So that is out in a residential area. If that works for you, that's great. But for a lot of people, they might wish to live in a small household, perhaps on what we call a campus of care. So there would be a library, there could be a daycare program, there might be classrooms for elementary students. That's a growing idea as well. And certainly at the Saskatoon Community Center, the Sherbrooke Community Center in Saskatoon, they have an elementary program called iGen, and the elders living in the home actually teach. And it's a really interesting program. So it depends on the individual. Some of us might be very happy living in the suburbs, and that's great. Some of us want more action and a greater ability to interact with others outside of our small household unit. But basically the key is the smaller homes, getting away from those big hospital-like units. It scares people, especially people with cognitive decline. It's very unfamiliar. None of us have ever lived really for an extended period of time, perhaps when we went away for school, but not in a unit of 30 people. And those are institutional models that simply uphold old institutional style of theories. And so I think one of the key takeaways is that yes, emotion-focused care is important, but it's inextricably linked to the design of the home as well, because that plays a significant role on your emotional well-being. And we need to start recognizing that and building accordingly.
And can you, and you've touched on this a little bit too, but I think we talked about what does the care look like, in the home, and a colleague of mine says, you're talking about the software, and then we're talking about the hardware in terms of what could the homes look like. So we're getting to this idea of smaller homes, and as you said, kind of could be out in a suburban setting, could be in a more, urban setting where people might want to be closer to the action. And you just touched on that a bit about being integrated into the community in different ways. And have you seen good examples? Because I've certainly, when I was in Denmark, for example, they want to showcase one of their new long-term care homes, which is right in the heart of kind of their urban area. They had a cafe on the ground floor. There was a gym in the building, for example, and the ground floor was really where basically the community was welcomed in to participate in a variety of different things. And the residents were all living on floors up above, for example, who could come down and interact, invite people up, if you will, to their homes. But it was one that really was bringing, the community into that home, as opposed to kind of keeping those residents isolated. So have you seen other examples where you've seen that in terms of how we've managed to kind of, again, support the interests and the well-being of residents by really kind of integrating them better into the community as well?
Yeah, that's a very forward-thinking approach. And so I think the example I gave previously related to the Sherbrooke Community Center, they have, first of all, they've opened up the doors within their home so that all people can come and go as they wish. Nobody is in a locked unit any longer. But in terms of bringing people in, they've got cafes now outside of the front of their home, and they have the daycare program, they have the elementary program, and Sue Ellen Beatty, who is the leader of the home, has been talking about, she's been designing a new build on the front of their property. They have a big green space there that would do pretty much exactly what you just described, and have cafes. She's talking about, people coming in and singing with guitars, and they would have more classrooms for Indigenous students focused on literature and art. They would have perhaps a running track or a walking track. So all of this, she's saying, so people could literally age in place. Instead of moving from one household to the next, you live in that community, which would have perhaps affordable housing for younger families, but you would live in your condo-like home or your life lease home until the end, and be part of this very interactive community. We're starting to see more of that in Ontario with some of the campus of care concepts. I think they could go a lot farther in terms of bringing in more people of different ages. And moving forward, we really need to start designing with that in focus, because the homes that we're licensing and building now are going to last for another 30 years. So if any of us are vulnerable enough to need them, that will be where we are living. So we really need to push for change.
You're right, and not even just 30 years, but we know that in this pandemic, we've learned about the homes that are still following the 1972 design standards. So it's not just 30 years, but it could be many more. I'm going to squeeze one more question before my final one to you, Moira. And this comes from, I think I may say the name wrong, but I'm going to say Mare, but it might be Mare. But it says, as a lifelong learner, I like the idea of community colleges integrated into continuing care homes, whatever they might look like. But she said, and gardens, animals, volunteer opportunities, and more. And I just wanted to come back to that idea of like gardens and animals, and that, like, is there a role, like, does that help, kind of from that emotion focused care? What have you seen, and what should we be thinking about when we think about some of those other ways to kind of integrate things?
Yeah, those are excellent points. And so I'll give you an example of the Eden Alternative. Talks about the elimination of loneliness and a sense of helplessness. And so one of the ways, it's not the only way at all, but one of the ways they do that is by really bringing gardens in and outside of the home. Now, people are very, very busy with gardening at the Sherbrooke Community Center. They follow the Eden Alternative there, and pets, and there are lots of dogs and cats in the community. Same at Carroll Woods. I think they had about 30 registered dogs, but as I said in my book, rumor had it the number was a lot higher. It makes such a difference for people. And again, at Carroll Woods, I met people who were outside gardening, working very hard in their gardens, carrying, lifting heavy things. They were people with pretty significant cognitive decline. I would not have known it by seeing how busy they were. So it really sort of puts a lie to what we think of when we think of people with cognitive decline. I found that so interesting about these homes is I kept meeting people who, yes, have pretty significant memory loss, but are very involved, very articulate, very busy with their lives. And that was so exciting. So gardening plays a major role. Teaching, again, Carroll Woods brought in students, like frontline workers who were studying, and some of the retired teachers would sit down and talk to them about aging and helping them move. So all these connections to each other and to nature is another piece that I write about, and I can't tell you how important that is. One example was a gentleman at Carroll Woods who would walk for hours around the home, and the CEO said to me, imagine there was a forest and there were people following him to make sure he didn't get lost. But said, imagine what he would have been like if he was in a locked unit. And that was just such a profound comment, because he probably would have been angry and very agitated, but he was calm. He didn't need antipsychotic medication to keep him calm, as so many homes often do. So nature plays a very important role as well.
That's brilliant. So Moira, my last question to you, because I know we're almost at time, is if you had a magic wand and if there was one thing that you could actually do to on what the priorities ought to be for long-term care coming out of this pandemic, what would they be?
It would be that the government doesn't leave it to the industry to create change. I know that some homes are actually implementing, some for-profit and not-for-profit homes are bringing in some of these new programs, so that's great to see. But a lot of homes will not do that. It's too easy to stay with the status quo, and it's hard to create change for many people. So I would, if my magic wand worked, it would be that the government would follow the Long-Term Care Commission recommendations and perhaps go even further beyond funding and promoting these programs, but actually requiring us to measure the changes that these programs make in the people who live in homes. And yes, additional staff are very important. Obviously, that matters immensely. We can use this moment to create a new approach with person-centered care and ways to allow people to thrive emotionally at any age and no matter what their ability.
And I think, just say thank you for that, because I think it's really important. And I think, through my work that's helping to oversee the development of new national long-term care standards, that might be a way where we can actually start really emphasizing this important piece in, right? Especially when, a quarter of our members of our committee are residents and family members themselves. This is what they're saying. This is what everybody's saying is that we need to do, because it's not just good for the residents, it's good for the staff, it's good for their families. And frankly, it sounds like what a lot of what you've just been talking about is actually good for our bottom lines as well, right? Having someone who's not on antipsychotics, not acting out, being sent to the hospital is actually, but can just have a lovely walk in the forest, for example, or interact with nature. It just sounds like this is the right way to move things forward. So Moira, thank you for your time and appreciate our conversation today. And I'm going to hand it back to Michael Nyson.
Thank you very much, Samir and Moira. That was an excellent conversation. And judging by the questions, we're hitting about 27. I have a feeling we probably could have spent a couple of hours together to go through all of those. Definitely a session I think a lot of people who weren't able to participate in today will appreciate seeing. I see some questions in the comments about whether this will be available. It will be as soon as we're done and able to package it up. We'll share it on our channels, and we encourage you to watch it again and certainly share it through your network. I think we heard a lot of great things today on how the system can be reformed, looking at things from a different perspective, as Moira did, in taking a positive approach to this issue. So thank you very much for that. A great discussion all around. Before we close, I'd like to thank our sponsors again, RBC Wealth Management, Royal Trust, and Essity. Thanks again to ECW Press for providing 3 lucky attendees with a copy of the book. You'll hear from us shortly as we do the random draw. Please stay tuned. We'll announce that as soon as we can. And finally, a thank you to everyone who participated today. It's a great turnout. I know that looking at the comments, it was well received. As we indicate at the top, this is our kickoff session. We'll be doing more of these going to the future, so we hope you could join the NIA as we take a spotlight on healthy aging through virtual sessions. And of course, this session will be made available to you, so thank you again. And with that, I'll give you the rest of your afternoon. Take care.